Chapter 4, The Passage of Urethral Instruments. The successful introduction of an instrument into the urethra depends upon the skill of the operator and his comprehension of the obstacles that may defeat the operation. Anatomy of the urethra. The urethra is the outlet of the bladder. It commences at the bladder neck, but embryologically and anatomically, that part of the floor of the bladder known as the trigone, i.e., the triangular space between the orifices of the ureters and the urethra, belongs to the urethra and will be so considered. The urethra tunnels the upper part of the prostate, perforates the triangular ligament, and terminates at the end of the penis. Its outer opening is known as the meatus, or the meatus urinarius. Figure 13, sagittal section through glans and fossa navicularis. Figure 14, transverse section of the penis. The urethra is divided naturally into two parts, the anterior and the posterior urethra, by the triangular ligament. The anterior urethra lying external to the anterior layer of that structure, and the posterior urethra being the continuation of the canal backward into the bladder. The anterior or spongy portion of the urethra is again subdivided into four parts: the navicular, or the fossa navicularis, figure 13, penile, figure 14, scrotal, and bulbous, or bulboperineal. The posterior urethra is subdivided into the membranous, the prostatic, and the trigonal portions. It is much more accurate to speak of a lesion, such as a foreign body or a stricture, as being at the penoscrotal angle or in the bulb, than to say it lies at a depth of 4 or 6 inches. For not only does the length of the urethra vary according as the penis is erect or flaccid, and in disease, hypertrophy of the prostate, but the urethral length, the urinary distance, varies widely in different healthy individuals. Page 37. The urethra is always a closed canal throughout its whole course, except when distended by some foreign substance. The mucous membrane of the urethra consists of a layer of epithelium, of which the superficial cells are squamous in the navicular and prostatic regions and columnar elsewhere, on a connective tissue basement substance particularly rich in elastic fibers to allow for the great distensibility of the canal.